Ireland AM is following 26-year-old administrator Victoria O'Brien as she receives laser eye surgery to help correct short-sightedness at the Maher private eye clinic. She has had a thorough consultation at the clinic and today surgery beckons. But is she nervous?
I am nervous, but I just keep thinking of the outcome, and it'll be so brilliant not to be able to use my glasses and contact.
To prepare her for the operation, Victoria has been given a Valium to keep her calm throughout, and numbing anaesthetic drops prepare the eye. A speculum is placed on the eye to hold the eyelid open. This prevents blinking and is considered the most uncomfortable part of the LASIK procedure. Professor O'Keefe covers the eye with a device called a microkeratome. With it, he slices the cornea from the side, producing a flap. Part of the device flattens the cornea during the slice, so as to create a flap of uniform thickness. The doctor then rolls back the flap to expose the inner layers of the cornea. With the flap folded back, the doctor makes a refractive correction on the inner layer of the cornea using the LASIK laser. The laser uses an infrared tracking device to track any slight movement of the eye and to ensure that the laser remains positioned on the area intended for treatment. After the laser, the flap is repositioned in its original position and the procedure is complete. So how has the surgery gone?
Victoria has a very tight eye. Some people have small openings of their eyes, the apertures are tight and some are large, so Victoria's was tight, but we did very well. We got a very good flap of the cornea and we got very accurate thickness of the flap, and so overall this procedure went extremely well. There's a pump in the inner surface of the cornea, and when the flap goes back down, this pump sucks the flap into place and more or less creates a suction effect so the flap sticks down. And then over time there's a healing process on the flap which causes it to heal further and to keep it in place. We'll be putting drops in today, antibiotic drops, and then we'll take the shield and she'll leave it on until tomorrow morning, and we'll see her early in the morning, and then she'll use the shield at night time for about a week, just in case she rubs the eye. There are 3 or 4 don'ts after the surgery: not to go swimming, particularly in swimming pools, not to rub the eye, and avoid maybe physical sport for about a week. But most other things are due after this operation.
And how soon will we know whether her vision is...
Well, we'll have a fair idea tomorrow morning, because usually people see very well very quickly. Usually this is a very, very rapid rehabilitation. This operation usually works very well very quickly, so we'll have a good idea tomorrow how she's doing.
Well, Victoria, it's all over. How was it?
Grand. I was expecting, the whole way through I was expecting this pain, and I was kind of really conscious, okay, is it going to happen now? The laser was turned on, is this going to be painful? But the whole way through was just fine. It just focused on the red light and it was grand. I'm really surprised. The worst part was the clamp going on and the eye being stretched, and that was the only bit of discomfort in the whole thing. It just flew, it's fine. I can actually see. I expected it just to be very blurry in this eye, but I can actually see out of it, which has surprised me.
Your shield comes off tomorrow, please God, and we'll see what progress has been made. Are you excited?
Actually, oh, so glad. The glasses are going in the bin and the contact lenses and everything, so thrilled.
Would you recommend it as a procedure?
Yeah, even 2 minutes after I even feel I'd go through it again, no problem, in an hour. Great.
Victoria, thanks so much.
This is a very intricate operation. A lot of things happen in a short time. This is why it's real surgery. And unfortunately, some people are portraying this as if it was nothing other than getting your hair cut. It's a big operation, but it happens quickly, and but it has a lot of big steps going on, and an awful lot of things could go wrong here.
Join us again tomorrow back at the Maher private eye clinic to see how Victoria's sight has improved following her laser eye surgery.